Bismillah ar-Rahman ar-Rahim. Today we talk about the blood supply of the brain. Actually, the brain have a good blood supply and it receives about 15% of the cardiac output. 15% of the cardiac output will go to the brain. The blood supply or the arterial supply of the brain can be divided into two systems. The first system is called the internal carotid system, which is also called the anterior system. And of course, the arteries here, we have the internal carotid arteries, right and left. The second system is called the Vertebrobasilar system, and also it is called posterior system, and also the blood or the arteries are the vertebral arteries, right and left. Vertebral arteries, the right and left vertebral arteries forming this posterior system. So the anterior system will give blood supply to the anterior and middle parts of the brain contents or the cranial contents, and the posterior, of course, would give blood supply to the posterior parts of the contents of the cranial cavity, which is mainly the cerebellum and the posterior part of the cerebellum. Now we will start with talking about the internal carotid system. How this system or how this blood supply reaches the brain. As you know, the internal carotid artery, it comes from the common carotid artery, and the common carotid artery arises from different sides in the left and in the right side of the body. We will draw here, this is the heart. Starting from the heart, well, this is the heart. This is the heart, and this is the arch of aorta. This is the aortic arch from the right ventricle, coming like this. And of course, this is the heart. In the right side, this is the right side. And here we have the left side of the body. In the right side here, there is the first branch of the aortic arch. Here we have the brachiocephalic trunk. This is the brachiocephalic trunk. This brachiocephalic trunk will give two branches. Will give the right subclavian artery, and it will continue as the common carotid artery. So it gives the right subclavian artery and the common carotid artery. And of course, the common carotid artery would divide into its two terminal branches, which is the internal carotid here at the level of C4 division, C4, which is also at the level of the upper border of the thyroid cartilage. And also here we have the external carotid artery. So brachiocephalic will give the right subclavian and common carotid artery. Common carotid artery will give the internal carotid artery and the external carotid artery. This internal carotid artery will enter the cranium and give a blood supply to the brain. While in the left side, the common carotid artery arises separately from the arch of aorta. This is the arch of aorta, or aortic arch. So this is the common carotid artery, common carotid artery, and it gives also here the left subclavian. This is the left subclavian artery. So here in the left side, each artery arises separately from the arch of aorta. The subclavian separate branch and the common carotid artery. While in the right side we have a common artery or trunk which is called brachiocephalic, and then this brachiocephalic will divide into right subclavian artery and common carotid artery. And of course here again this branch will give us two branches, which is the external and internal carotid artery. This is the external carotid artery, and this is of course the internal carotid artery. After dividing into right, external and internal, the internal carotid artery will ascend within the carotid sheath. This is the carotid sheath, and you know what are other contents of the carotid sheath, of course here also. What are the contents of the carotid sheath? You know, we have the vagus nerve, and also we have the internal jugular vein. We have the vagus and internal jugular vein within the carotid sheath. So it ascends within the carotid sheath, this artery, it ascends within the carotid sheath, and it reaches the base of the skull, and it enters the skull cavity or the cranial cavity through a foramen which is called the carotid canal, which is in the buttress part of the temporal bone. Through this carotid canal, the internal carotid artery will pass for a short distance within the bone and emerge and enter the middle cranial fossa through a foramen which is called foramen lacerum. So it's called foramen lacerum. Then I will draw it in this way. The internal carotid artery ascends in the neck, of course on each side of the neck. So it ascends and it reaches the base of the skull. This is the base of the skull. This is the anterior cranial fossa. This is the posterior cranial fossa. Here it will enter through an opening, and this opening it leads to the carotid canal. And this pass through the carotid canal here, the pass within the bone. This is the bone. And then it goes to the intracranial fossa, the cranial fossa, through a foramen, and this foramen is called foramen lacerum. So this is carotid, this is carotid canal, and after it leaves the canal, within this is the petrous bone, it leaves this canal and enter the middle cranial fossa. This is the middle cranial fossa, middle cranial fossa, and it enters middle cranial fossa through a foramen, which is this foramen is called foramen lacerum. You know foramen lacerum? Yes. Its end is مشرشة بتكون حافات مالها تكون مشرشة ولا يسموها lacerum. Lacerated lacerum is opening. So this internal carotid artery passes through carotid canal, and then it enters the middle cranial fossa through foramen lacerum, and then once it leaves the foramen lacerum, it will enter here a cavernous sinus. You see, you know, this is the sella, this is the sella turcica, which is in the body of the this is anterior cranial fossa, this is middle cranial fossa, this is posterior cranial fossa, and here we have the sella turcica, and here we have the pituitary gland. You know, this is the pituitary gland within the sella turcica. Here we have a sinus which is called the cavernous sinus, and of course here we have the orbit. You have the orbit, and this is the eye. Once it enters the middle cranial fossa, the internal carotid artery will pass through the cavernous sinus, and once it leaves the cavernous sinus, it gives its branches. What are these branches? One of these branches is the ophthalmic artery. The first branch of the internal carotid artery is the ophthalmic artery. So the first branch is the ophthalmic artery, and of course this ophthalmic artery will give a supply to the muscles and contents of the orbit. Here we have the muscles of the orbit, and also it gives another branch, is posterior ethmoidal artery, and it gives the anterior ethmoidal artery to the ethmoid bone, and lastly it will end by dividing into the supraorbital artery and supratrochlear artery. You know this artery. Of course, here we have another artery which is very, very important, which is called the central retinal artery. Central retinal artery, which is go to the retina that's placed in the eyeball. So this is the central retinal artery. Central retinal artery. All these branches are from the ophthalmic, and as we said, that this is the first branch of the internal carotid artery. This is supraorbital, and this is supratrochlear, and of course this is the posterior ethmoidal, and here we have also anterior ethmoidal. All these are branches of the ophthalmic artery. The other branch that given from the internal carotid artery, here we have another branch which is called arachnoid artery. Here's arachnoid artery. Arachnoid artery, they supply the arachnoid plexus within the ventricles, arachnoid, anterior arachnoid artery. Sorry, not arachnoid. I'm sorry. Anterior choroidal artery. Anterior choroidal artery. Anterior choroidal artery supply the choroid plexus within the ventricles that is responsible for the formation of the CSF. The other branch, which is called the posterior communicating artery. The posterior communicating artery, we'll discuss it in details later on. This is called posterior communicating artery. And also it gives the superior cerebral artery. Here, superior cerebral artery. This is the superior cerebral artery, supply the anterior part of the cerebrum. This is anterior cerebral artery. And it continues as the middle cerebral artery. Middle cerebral artery. So here we write the branch of the internal carotid artery, branches of the internal carotid artery are, of course, on both sides. We have number one, ophthalmic artery, and second we have the anterior choroidal artery, and we have the posterior communicating artery, and we have the superior cerebral artery, and it ends by forming the middle cerebral artery. So these are branches of the internal carotid artery that supplies the anterior part of the cerebrum, and of course some of it supply the orbit through the branch of the ophthalmic artery. So this is system, internal carotid artery, is called the anterior system or internal carotid system that supplies this part of the cranial cavity contents. Now we will talk about the vertebrobasilar system, and as we said, the vertebrobasilar system is formed by source matter is by the two vertebral arteries, and two vertebral arteries, as you know, we have two vertebral arteries. The vertebral arteries arise from here. We write in a green color, but of course it's not green, it is red. It starts from the first part. You know, the subclavian artery can divide into three parts. This is first part, this is second part, and this is the third part. First part, second part, and third part. So it arises from the first part of subclavian artery. It arises from the first part of subclavian artery, and this is the vertebral artery. And of course here, the same thing on the other side. From the first part, the vertebral artery arises. The vertebral artery ascends in the back of the neck, medial to a muscle which is called scalene muscle, Here we have a muscle which is called scalene muscle. Anterior scalenus muscle. Medial to this muscle, on the back of the neck, this vertebral artery will ascend and enter through the cervical or through the foramen in the transverse process of the cervical vertebrae. And as you know, we have 7 cervical vertebrae, and the transverse processes of these cervical vertebrae have a foramina, which is called foramen transversarium, and the vertebral artery will pass through this foramen, but it starts through the through the 6th cervical vertebrae, not the 7th, through the 6th. And this is the vertebra here. Here we have the vertebra. And here we have the transverse process of the vertebra. This is the body of the vertebra, of course. And this is foramen. Here we have an opening. So the vertebral, this is the 6th cervical vertebra. This is the 6th cervical This is the 6th cervical vertebra. So the vertebral artery will ascend here, passing through this cervical. Of course, here is the 5th and the 4th and so on till it reach the foramen magnum, where it is enter the foramen magnum. You see? So this is very important. It passes through the foramen in a transverse process of the 6th cervical vertebra. So it ascends and enter. Both of these vertebral arteries will ascend upwards, and when it reaches the foramen magnum, they pass slightly medially and enter the foramen magnum. And after it enters the foramen magnum, it ascends medially, anteromedially, until it reaches to each other and unite to form single artery, which is called the basilar artery. And of course, the vertebral artery, before it unites with the vertebral artery of other side, it gives many branches. And when it becomes a single artery, which is called the basilar artery, also it gives many branches. These branches are, well, this is the right vertebral artery, and then it passes anteromedially. Here we have the other one, and pass here, as we said, and here to become single artery, which is called the basilar artery. What are the branches? This is, of course, the vertebral artery. Well, the first branch is given from the vertebral arteries. We have a branch here, which is come here like this, and another one comes here and unite to each other to form single artery, which is called anterior spinal artery. So the first one is anterior spinal artery. This anterior spinal artery will descend in front of the spinal cord and will supply the spinal cord. The other branch here, actually, here I would write in a green color, like this, and descend, and another one from here and descend and this is called the posterior spinal arteries. So the anterior is only one, but the posterior is two. Posterior spinal arteries, or artery, have two, this and this. The other branch which is given from the vertebral artery is called the posterior inferior, here, the posterior inferior, of course on both sides. This is called the posterior inferior cerebellar artery. Posterior inferior cerebellar artery. نختصرها ونقول PICA. PICA. Okay. So the other branch قلنا anterior spinal artery, posterior spinal artery, وعندنا posterior inferior cerebellar artery. This artery. Of course, we have also here meningeal arteries. We have meningeal arteries. Meningeal arteries. Then, as I said, both arteries, vertebral arteries, they pass anteromedially and unite to each other. Where is they unite? They unite at the junction between the pons and the medulla oblongata. Here, exactly, we have the junction of the medulla oblongata with the pons. So, but this is the pons. This is the pons. This is the pons. And here we have the medulla oblongata. And of course, after the medulla oblongata, we have the spinal cord. So this is the spinal cord. And of course, this is the medulla oblongata. Okay, you see? At the junction between the pons and medulla oblongata, the two vertebral arteries unite to each other and ascends on the ventral aspect of the pons. And here is the pons. Of course, after the pons, we have here the, what's the structure? We have the midbrain. This is the midbrain. The midbrain. This is the midbrain. So it ascends, this artery, it ascends here, and this is called the basilar artery. Tonight they call it the basilar artery. You see, this is the basilar artery. The basilar artery will give branches. The artery give branches. The first branch, which is given by the basilar artery, is called the anterior inferior cerebellar artery. Here, the anterior inferior cerebellar artery. You see the posterior inferior cerebellar artery, and we have the anterior inferior cerebellar artery. Which means that this is the area of the, here we have the this is the cerebellum. Okay, so this is not here. This is the cerebellum, of course. He's behind. Of course, this is behind. Okay, this is the cerebellum. So the first branch from the basilar artery is the anterior inferior cerebellar artery. Okay, is it clear? Okay, the other branch from the basilar artery is a branch which is a long branch, which is called and goes to the inner ear, which is called the labyrinthine artery. Labyrinthine artery. This artery, labyrinthine artery, arises from the basilar artery. It goes with the eighth cranial nerve, which is the vestibulocochlear nerve, and they pass to enter the inner ear through the internal acoustic meatus. You know, the internal acoustic meatus in the petrous bone of the temporal bone. Through this opening or foramina, the labyrinthine artery will enter to supply the labyrinthine system in the inner ear. Other branch of this basilar artery, we have the small multiple branch, which is called pontines. These branches are called pontine arteries that supply the bones. Arteries that supply the bones. Okay. Then, before it reach the midbrain, the basilar artery will give the superior cerebellar artery. Superior cerebellar artery. Here is the cerebellar. Yes. This one is superior cerebellar artery. Of course, on both sides. So we have the cerebellar arteries. We have two inferior, anterior and posterior cerebellar artery, and we have one superior cerebellar artery. Okay. After giving this superior cerebellar artery, the basilar artery will terminate and divides into two main arteries, which are called, these arteries are called here at the junction between the bones and the midbrain. The first branch is, the bifurcation is this is the which is called the posterior cerebral artery. This is the posterior cerebral artery. Posterior cerebral artery. And as you know, the anterior and middle cerebral arteries are branches of the internal carotid artery, while the posterior cerebral artery is the terminal branch, one of the terminal branch of the basilar artery. So all these arteries are called vertebrobasilar system or posterior system that supply the posterior parts of the brain. The anterior system. With the posterior system, there is an anastomosis between a branch from the anterior system and branch from the posterior system, and this anastomosis will form a circle-like structure, and this circle-like structure is called the circle of Willis. This is the circle of Willis. You see, this is our drawing. We have, I will repeat, we have the vertebral artery. This is the vertebral artery. ascends upwards and would enter through the foramen magnum. Here is the foramen magnum, and they unite at the point, at the junction between the pons and medulla oblongata. And of course here we have the cerebellum. So yes, and this is the medulla oblongata, and this is of course the pons. Here's the entire pons. Sorry for the medulla oblongata here. Sorry, not here. Of course not here. Yes, this is the medulla oblongata, and behind it we have the cerebellum. So it ascends, and between the junction between the pons and medulla oblongata, here the two vertebral artery unites, and before it unites it gives multiple branches. We have the anterior spinal arteries, we have the posterior spinal arteries also here not present in this picture, and also we have the posterior inferior cerebellar artery, and then they ascend together and unite to form the basilar artery. This is the basilar artery. It gives a branch. Its first branch is the anterior inferior cerebellar artery, and then it gives another branch. Actually here it is not present in this picture. It's labyrinthine artery, and of course the other arteries are the pontines arteries here, and then it gives the superior cerebellar artery on both sides, and then it ends by dividing into posterior cerebral artery on both sides. And here the internal carotid artery, of course this view is from the ventral aspect of the brain, as say, yeah, as if the brain behind this paper, and you see the base of the brain. So the arteries come here from the foramen basilar to the brain tissue. This is the internal carotid artery, and this is the internal carotid artery. It gives first of all the ophthalmic artery, as we said, and then it gives the anterior choroidal artery. This is the anterior choroidal artery, and then it gives the posterior communicating artery and the superior cerebral artery, and it ends by forming the middle cerebral artery. You see? So this posterior communicating artery, a branch of the internal carotid artery, will anastomose with the posterior cerebral artery. You see? And also, of course, by this artery is called posterior communicating artery. And the anterior cerebral artery, this is 1 and this is 2. Between the two anterior cerebral arteries, we have a small connection here, a connecting vessel, which is called anterior communicating artery. This is the anterior communicating artery that connects between the right and the left anterior cerebral arteries. So by forming this connection, we will end with a circle, and this circle is called, and of course this is in the base of the skull, of the brain, sorry. You see this circle, like would be here. This circle is be here, and this is called the circle of Willis. You see, by two these connecting vessels, this one and this one, the anastomosis occurred between the anterior system and the posterior system. And of course here we have the this circle, which is called the circle of Willis, and you see the arteries that form this circle. I will repeat again, inshallah. This is the internal carotid artery. This is the middle cerebral artery, and of course this is the anterior cerebral artery, and this is the posterior cerebral artery, which is the terminal branch of the basilar artery, the basilar artery. So the branch from the internal carotid artery, which is called posterior communicating artery, will anastomose with the posterior cerebral artery, which is a branch of the vertebrobasilar system, and this is internal carotid system. The other site of anastomosis is between the anterior cerebral arteries. Here is the anterior cerebral artery, this anterior cerebral artery, a small connecting vessel between these form is called anterior communicating artery. By doing this, by the basis of this communicating vessels, this will form a circle, and this circle is called circle of Willis. So circle of Willis, very important clinically, but we will not discuss it. We will discuss it inshallah in other lectures about its clinical importance. So circle of Willis, the blood can pass from the anterior system to the posterior system through this circle, or this circle of anastomosis. Now lastly, we have to say about the blood supply of these vessels. Actually, you have the anterior cerebral artery will supply the anterior part of the cerebrum, and we have the middle, it will supply the most of the lateral part of the cerebrum. Regarding the anterior cerebral artery, it will supply also the frontal lobe and most of the medial surface, anteromedial surface. All these things, these things will be supplied also by the medial aspects of the frontal lobe, and part of the parietal lobe will be supplied by the anterior cerebral artery. And the middle cerebral artery will supply most of the lateral part of the hemisphere of the brain hemisphere. And of course, the posterior cerebral artery will supply the occipital region, posterior cerebral artery, occipital region of the cerebrum. Thank you very much.